Hello viewers, I am Dr. Shaileshkumar Garge, Intervention Radiologist, Citi Vascular Hospital. Today we will talk about, is there any non-surgical scarless treatment or method is there for the treatment of benign breast lumps or breast fibroadenomas. So we'll see in detail like why it occurs, how to diagnose, what are the symptoms, and what are the old methods and what is the new method which is a scarless treatment option for the breast fibroadenomas. So benign breast lumps, that is breast fibroadenomas, are very common and they are usually seen in the young girls, like between the age of 15 to 25 in most of them, and most of the times they don't cause any symptoms, they are asymptomatic. Very rarely they can cause pain, sudden increase in size causing swelling and change in the shape of the breast. Some ladies can experience pain in these fibroadenomas during the time of periods. Apart from that, most of the times they are asymptomatic and they are also called as mouse breast. Means when you touch or try to feel them, they keep moving under the breast. So that's the reason they are also called as breast mouse. The reasons for the fibroadenomas is most of the times it runs in a family history is there, or genetic cause, and young girls with hormonal imbalance and overweight, obesity. These are the main reasons for the fibroadenomas to occur. Apart from this, if the patient is having lumps or they are symptomatic, then we need to diagnose this. Most of the times it is by the physical examination by your doctor, and if they have a doubt whether these are benign lumps, that is safe lumps, or they are cancerous, then the patient need to undergo few investigations like sonography, that is called as sonomammography, or mammography with the X-ray, and very rarely MRI breast or those things are required. So after doing the scanning, if still there is some doubt, because sometimes some lesions or lumps they are suspicious whether it can be a cancer or benign, we are not very 100% sure on this imaging, then we need to undergo a needle test, that is fine needle aspiration test, that is FNAC test, and sometimes biopsy also, because FNAC results sometimes they are inconclusive. In that case we may have to go for the biopsy. So these tests will confirm whether the lesion is benign or cancerous, or what type of cancer it is, so we can in depth we can identify the nature of the lump. So once we diagnose that is a benign breast lump, that is fibroadenoma, traditionally what we are doing is the surgery. Lot of patients they ask, like, because I don't have any symptoms, I just feel it when I touch the breast, so are there any medications to cure this? So there are no effective medications to cure the breast fibroadenomas. Once they are formed, most of the times they persist like that, or they slowly increase in size. Very rarely they go under rapid growth in size. In that case we may have to undergo the proper treatment. So there are no effective medications. So what are the methods to treat these fibroadenomas then? So traditionally we are doing the surgery where we cut the breast, we remove the lump, and then they put the stitches back to close the breast region. That is the way of removing this breast fibroadenomas. But are we following the same old trends? Are there any new methods to treat this breast fibroadenoma? Because lot of young girls, those who come to our consultation or our hospital, they ask either for the medications and they don't want any surgeries, because they are either scared of the surgeries or they don't want any scar on their breast. So this VABB treatment at Citi Vascular Hospital, that is vacuum assisted breast excision of the lump, is a very effective non-surgical, completely scarless. Cosmetic wise there are no stitches, no scars on the breast, and patient can be discharged in the same day. So it's a 30 minutes to 1 hour procedure depending upon the size of lump and number of lumps in the breast, and it is very effective treatment, is as good as removing it surgically. So what we do in the VABB is we get into the lesion same like how the biopsy is done. So we'll put a needle into it. That needle is very small, will it's almost 2 millimeter size of the hole will be there, and we'll get into the lump and we'll cut the lump into small pieces and suck it out because of the vacuum aspiration. So the whole lump is removed rather than surgically how we remove the whole lump in toto. Here we cut it into small pieces and then suck it out. So most of the ladies, they ask whether all the lesions or complete lump will be removed with this. Yes, definitely, because this treatment is done under same scanning method how this fibroadenoma are diagnosed, that is ultrasound. So we know that whether the complete lump is removed or not. So that is the VABB treatment. And there is another method of treatment, that is thermal ablation with the microwave or RFA. What we do in this is we get into the lump through the same needle and we connect that needle or the antenna to the machine where a proper temperature is given, so that the heat is transferred to the lump and the lump is completely destroyed. And slowly over a period of time, the body, any dead tissue in the body, whether our RBC is like, so any dead tissue is slowly absorbed by the body and get dissolved. So these are the two methods of treatment are available which are completely non-surgical. So now patient don't have to worry about the cosmetic thing, that is scar on the breast, or they don't have to go for the major surgery, giving the anesthesia. All those things can be avoided with this treatment and is completely safe and very effective, as good as the surgery. Thank you. If you have any doubts or questions or comments, please put them in the comment box. I personally read each and every comment and will try to answer them in our next video. And if you have any reports and you want to take a second opinion, please send the reports to the given number on the WhatsApp, and we'll get back to you in a day or so.